The break of dawn, as a quiet calm settles over the city, something remarkable awakens.
Nestled along the nation's busiest motorway, on the outskirts of Nigeria's financial heartbeat.
This is Redeemer's Health Village, a vision, a commitment, a future redefined, where every patient matters. Welcome to where healing begins.
Every day I wake up now and I see the services we provide. I'm grateful to God that we have an opportunity to hold the hands of those who truly need care.
Then we start the work by doing a morning review where all the doctors come and we discuss all the patients on the ward. That's like a very important piece of the day in the hospital because we have to review everybody that's coming through the emergency, everybody that's been admitted on the ward, and then we take decisions of what we need to adjust, what we need to remove, and other things we need to do.
Nursing at RHV is streamlined to a very one key component, which is patient is king. Following through these components specifically, I would like to streamline them to say our workflow process is one of the number one key points we'll be using to make sure that the nurses at RHV are up to speed and are able to give us the best of what is expected as far as patient care is concerned. Specifically, we are patient-centered. So it's not just about what we do in order to help the patient, but it's about what we do to help patients inclusive with his relative. Something you need to understand about the patient or an individual who comes to you in a hospital or a clinic settings, not just only the person who is sick comes to you, but also the person who brought the person who is sick to the hospital needs to be catered for. One of the measures that people have not really paid attention to all this while is the particular person or the family. For instance, a sick child comes to the hospital. Have anybody considered the mother that brought the sick child? What is her state of mind? So therefore, that's why we always think about the number one key thing being patient is king.
The Redeemer's Health Village was born from a simple, powerful belief that Nigerians deserve world-class healthcare at home. With 150 beds and dozens of specialties, RHV is more than just a medical facility. It is a one-stop village of healing.
Wellness services is one of the services that we also offer here of global standard. We've seen many patients on their way outside the country to do their wellness check, and then coming around here, they discovered that what is obtainable outside the country can also be offered here. So they canceled their flights and came in for their wellness check, and they were not disappointed with our services.
Innovation and excellence, guided by faith, anchored in evidence, and built with integrity. This is a vision realized not just for today, but for generations to come.
The most important person in RHV is the patient. The patient is the king. Any patient that comes into this hospital must leave happy with the service that we have delivered. Okay, it's not just the hospitality. It is also going to be the care that is evidence-based, okay, and using cutting-edge technology with highly motivated workers. So every patient that walks into our hospital must be very satisfied going out.
My patients are here. Immediately they start to pick them one after the other as they come. We take their PCV sample, we put them on the machine. We give them, after they are on the machine, I stay at the center to give them health education. You know, so many things happens when patients come for dialysis. 2 or 3 days after, they start feeling uncomfortable again. It is because they don't have the right knowledge. But when they have the right knowledge, oh, sir, ma, eat this, don't eat this. By the time they are coming the next time, you can see that, oh, they are having the best life that you can give them even as a patient on dialysis.
The journey to healing starts here. With every smile at the front desk, every helping hand guiding the way, RHV ensures patients don't just feel cared for, they also feel seen. First impressions matter. And at RHV, they're always intentional.
We are the first faces you see and it's our utmost priority to attend to your needs.
Okay, do you have any questions, any complaints about our service?
The service is good. I enjoyed it.
Okay, that's good.
Thank you very much.
So the doctors will soon come to see you. If you have any concerns, you can let them know.
All right,
thank you very much. Have a good day, ma.
You too. Thank you, ma.
One of the visions of the principals of RHV was to ensure that the experience of every patient is the best. And they have been very keen that patients don't have to move around the hospital to be able to access service. One of the things that we should picture is coming in with a very high fever in the hospital. You are sent to go and register. From the registration point, you go to see a nurse 5 minutes away. From the 5 minutes away, you go to the laboratory. From the laboratory, you go back to the doctor. From the doctor, you go back to the pharmacy. In RHV, you come in, you sit, and the service comes to you. We ensure that your movement is minimalized while you're in RHV. We also currently run a program that is clinic at your doorstep. So we take RHV to different corporate organizations so that they don't have to come to the hospital. We will go to them to provide services. As a patient in RHV, we want you to not feel bothered or stressed by our care. We want you to be able to get a sense of comfort as if you were in your home receiving care. That's why we have carts to take you around the hospitals. Patients don't have to walk the corridors. They can get into carts, and the carts will drop you at different stations within the hospital.
At RHV, technology isn't just advanced, but also purposeful. With West Africa's foremost 70cm bore MRI and a 160-slice CT scanner,
RHV radiology is so special in that we have state-of-the-art equipment. For example, our MRI 1.5 Tesla with 3 Tesla capability is one of the best machines here in Nigeria and West Africa. There are only 2 of it installed in West Africa, and 1 of it here is in Nigeria. Then we have a CT, a very advanced CT. We have ultrasound, we have mammography. We have specialized techniques, CT perfusion, MRI perfusion, spectroscopy, we have all that. And here at RHV is the best place to be a patient. We have a very dedicated staff with 24-hour service.
So as the chief radiographer, I ensure that everybody is available, and every work and the scheduled patients who are supposed to have for the day, that we're already preparing for them and that we're ready for them. So that as soon as they walk in, we're attending to them as fast as we can. So basically, just keeping up with the department and making sure that everything is running. We need to check the equipment, like we normally do QC and QA, to be sure that every equipment is functioning as it should.
When you come into the radiology of RHV, you expect, 1, prompt care, very compassionate care. We are very compassionate, we are very engaging, we are very sensitive to your needs. We have 24-hour service, so anytime you come, we are ready for you, be it in the morning, afternoon, evening, at any time. Emergencies, no matter how complicated the case, we are here for you and we can handle it and resolve it.
As soon as you enter, the radiographers are already waiting for you. So we're welcoming you, we're taking you through the investigation you have to do, we're explaining to you what you need to do, because we want your maximum cooperation so that we can actually go fast with what you came in to do. And as soon as the images are acquired, you are getting your film printed out, you are getting your CD printed out, and your images and the report is sent into your email, because we must have gotten it from your entrance as you are entering the department. So we're sending your report to you, to your email. If you wish it to be sent to your WhatsApp, it will be sent to your WhatsApp as a soft copy. If you still need a hard copy, it will be sent to you. All these are done within 24 hours maximum.
We undergo frequent training. There's a training coming up in which United Imaging is coming over from the US to come and give us training here, in July, in conjunction with UCH, Radiology Department, UCH Department. So we have a lot of updating that we'll get from our foreign partners, and then regular trainings, efficient service, dedicated staff. That's how we do. That's our role in radiology department at RHV.
Our city is a 160 slide city. It does virtually every study. We do biopsy, we do cerebral angiography, we have carotid angiography, we have colonoscopy and bronchoscopy. So we do all these investigations with the 160 slides machine. When we say 160, it means that it is as quick as you can imagine. So it doesn't take anything from you just to do the investigation. Now in the MRI, we do perfusions, we do MRS, which means magnetic resonance spectroscopy in cases of tumor. We do MRCP in cases of cystography or cholecystitis. We do MRU in terms of urography for any age at all, both for kids, adults, even claustrophobic patients. We actually attend to them.
Our MRI is a 1.5 Tesla MRI, AI supported with 3 Tesla imaging. It is the first in West Africa with a 70 centimeter ball, which means that no matter the size you are, you can still get your MRI done within our system. And the issue of claustrophobic, which makes a lot of people not want to use the MRI, has been reduced or totally eliminated with the current MRI we have in-house.
Radiology department, RHV, is the best place to come for your imaging, the best place to get the best report, and the best place to be a patient.
I'm going to take you through our laboratory, our services, and what we stand for. I'm going to take you through by starting with our chemistry department. This is our chemistry semi-automated machine. This is BA88A. It's meant for quick tests. At RHV, we value turnaround time. Taking our patients through a well-processed and organized system is what we value most. We don't want to waste their time. That is why we got this. In case a patient is going for MRI and you need a quick creatinine test, one thing that we value at RHV is technology. We invested greatly in cutting-edge technology. And one of our machines that we use is what one of my colleagues is using. This is our BA88A. It's fully automated chemistry machine. It can run an array of tests. Your cardiac markers, your kidney profile, your liver function test, bone metabolism. This machine can run 68 samples plus provision for emergency are 11 samples. Turnaround time is one of the things, one of our selling points. You can come in for your test, and within a very short period, you'll be on your way back. Also, we have what we call Gazelle. This Gazelle, as small as it is also used for hemoglobin analysis. One of the advantages is it is totally different from normal electrophoresis machine, which are qualitative in nature. But this has capacity to quantitate the hemoglobin, different hemoglobins. We have seen a lot of cases whereby people are giving AS, AA. At the end of the day, we found them not to be so. But here, with the quantification method of the results, you can see that you can't miss the diagnosis. It was in those days that people, whether you need, you are a trauma patient or a patient going for theater, or even maternal cases, postnatal hemorrhage, whereby maybe after delivery, a patient is bleeding. We made sure that these patients are given whatever that blood component that they need. Is it red cell that you need? We'll give you. Is it the plasma, especially the trauma patients? We'll give you. Or is your case in need of platelet? We give. We don't just pump blood into people's system. We give you according to your need.
And most importantly, we have a very big blood bank, which has been supported by the National Blood Bank Service of the UK by donating quite a few equipments to us. And we're hoping that the blood that we will be able to get from the community, particularly the Redeem community, we will be able to help other hospitals care for patients that are in need.
Right here is one of our fridge that we used in preserving all this blood and blood products. All our blood and blood products are well preserved under good and quality conditions.
We then have a fantastic ophthalmology center, which is well equipped and can care for all kinds of ophthalmology cases.
Ophthalmology here in ROHV, but if I must say, is one of the best ophthalmology clinic I've worked. Okay, so because we have the state-of-art machines in this place. We have the OCT, we have the CVF, the Central Visual Field Analyzer, which helps us to diagnose glaucoma. We have the non-contact tonometer, which also helps us in diagnosing glaucoma. We have fundus camera, which helps us in diagnosing retinopathy, whether diabetic retinopathy or hypertensive retinopathy. So we also have auto-rev, which helps us to diagnose the kind of refractive error our patients have and give them the quality glasses they need. We also do surgeries, all kinds of surgeries, glaucoma surgery, cataract surgery in ROHV. The way we relate with patients here, we are compassionate, we feel their pain, we go through with whatsoever thing that they are going through. We try to put ourselves in their shoe to understand what they are going through. So with that, it helps us to take very good care of them. And also we have all the machines that help us to diagnose whatever they are having, whatsoever sickness they are going through. So we have machines that help us to diagnose that and makes it easier for us and for the patient as well.
The unique thing about pharmacy practice in Redeemer's Health Village is the patient flow process that we have for our patients here. So patient is king when it comes to Redeemer's Health Village. So our patients are well taken care of. Patients sit where they are attended to and medications are brought to them. Counseling, pharmaceutical counseling is done for all patients, for all prescriptions, where we talk with the patients, show them the medications one by one, and then ask if they understand what they are taking, how they are to take it. One of the unique features of pharmacy practice in Redeemer's Health Village is the automation of processes. So there is SOPs for everything that concerns pharmaceutical practice here, for our inpatients, our outpatients, our walk-in patients, VIP patients. For every step, for everything that is to be done pharmaceutically, there is an SOP, there's a process to it that makes the whole thing to be seamless. So when a patient come in, whether they are in the ward, whether they are in the emergency unit, or they are at the outpatient department, there is a seamless flow, automated processes at all times, so that both staff and the patient know what to do at every point, so the patient is attended to seamlessly, and that's quite unique when it comes to pharmacy practice in Redeemer's Health Village.
We have a very well-equipped trauma center. Our trauma center can take up to 15 patients. We have ventilators in the trauma centers, and we have the specialists to be able to meet the needs of trauma patients. As you're aware, we are on the express route, and the Lagos-Ibadan, Lagos-Abeokuta route tends to have a lot of accident victims. So we will be able to care for patients who have been involved in trauma of all forms. We also have a lot of factories around us, and our trauma center will care for patients who have such trauma.
When emergencies strike, seconds matter. Lives depend on readiness. At Redeemer's Health Village, preparedness is not a protocol, it is a promise. From accident scenes to the moment an ambulance will touch our emergency bay, a seamless response begins. Calm, coordinated and committed. And as the patient is guided to our surgical theaters, they enter a world of precision.
Being located close to the busiest road in Nigeria, that's Lagos-Ibadan Expressway, we've been attending to many road traffic accidents, and we've been getting a good result because we have an in-house facility to attend to that.
We have the general surgeon who comes in, sees his patients, runs his clinic, has done multiple surgeries here, even surgeries that people have been afraid to do in other facilities. When they come here, we get them done with the speed of light. We also have our pediatric surgeon who we work with side by side, has done a lot of interceptions, good outcomes. For pediatricians, we work with the obstetricians and the gynecologists. So for our cesarean sections, our success rate is 100%. We have had good outcomes with all our deliveries. Then for the pediatric surgeon, who is also here with us, who is part of our team, we have most of the surgical procedures we've done, we have had good outcomes too. Good success rates, good outcomes. We have followed up these patients in clinic and they are doing very well.
These rooms are equipped with state-of-the-art technology, advanced imaging system, precision tools, and real-time monitors that transform every procedure into a symphony of science and skill.
I could remember a case that I've toured around Lagos for almost 1 year. And then coming into this facility, within 5 hours, this woman was wheeled to the theater, prepared, result ready, blood ready. We have all in-house for all the investigations necessary. And we've seen many people going abroad to seek for not only wellness, even for some particular surgery, and then coming over here, looking at the facilities, and they're obliged to access the services from here. And then we've seen people coming from abroad. At least we had a patient from England that was on the waiting list over there, and then the procedure can be carried out over here. And then she flew back from England and accessed the services. And the surgery was done within 24, 48 hours over here, and did very well, and returned back to England and sent a letter to us to appreciate what we have been doing.
Beyond the emergency lies expertise, precision, healing with skill. At Redeemer's Health Village, every department is a universe of its own, from the beating heart of the cardiac unit to the quiet lifelines of the dialysis room. Surgeons operate not just with tools, but with trust. Every cut is careful, every stitch sacred, and when life begins anew in the maternity unit, the miracle is complete.
Okay, well, the pediatrics unit runs a day-to-day activity. We have our outpatient clinics where we see our patients. Then based on our examination and findings, we'll admit some on the ward. We also have our neonatal intensive care unit where we manage our children who are born premature, and also children who are even carried to 9 months and who require some intensive care. We also admit them, and our success rate has been wonderful. Yes, in RHV, we have our neonatal ventilators, which are not very common, but we have our neonatal ventilators available, very functional. We have our anesthetists on ground and other intensivists who are here to use these machines when we require, and our outcomes have been good.
Recovery is a vital tool as the treatment itself. It is here that healing takes root slowly, steadily. From VIP suites to the general wards, RHV offers a sanctuary where rest is respected, dignity preserved, and recovery nurtured. Comfort is not a luxury here, it is part of the medicine.
For dialysis to be effective, patient needs purified water capital letter on purified water, because purified water is what makes a part of our dialysis. And that's why we have our water room. It goes through stages of purification. If you've been to any bottling company before, either pure water company or bottled water company, it is the same thing, the machine that they have there that purifies the water that we take every day, that we also have here. So that when the water is being purified, the machine sends it directly to our own dialysis machine so that we have effective dialysis. And how do you know whether your water is purified or not? It starts from your patient. Your patient starts having rigor intra-dialysis. It's been over 1 year of my practice in this hospital. Our water is tested and trusted because I've never seen any patient add rigor or fever intra-dialysis. And what does that tell you? That our water is so purified.
We also have an oxygen plant that can produce up to 150 to 200 cylinders in 24 hours. That means we can also supply oxygen to all the 8 facilities in this vicinity. Since we started operating, we have served as a referral center to many private hospitals around here, and many health facilities around here have been referring their cases and to us, and we've been getting good results from those referrals.
Here in the medical gas plant, we do supply medical aid to the ward for the ventilator, vacuum for suction machines and oxygen. And in the plant here, we have a big plant here which supplies 240 cylinders in 1 hour and a backup of a 60 cylinders capacity for a backup in a situation whereby we don't want to on our plants to run because this is connected straight down to the ward. As you power this, it feeds the system directly. So this 300 bedded capacity is being powered by this 240 cylinder oxygen capacity. So on a full constant, we are running on a 99% purity oxygen constantly, and for a backup with a 60 cylinder oxygen gas plant, which fills into a bottle and feeded through a manifold system.
Faith isn't an afterthought. Here, it is the atmosphere. From decision to diagnosis, every moment is steeped in compassion and guided by divine intention. At RHV, medicine is more than science. It is ministry. It is service. Because when faith leads, healing follows.
I was once a patient, VIP patient. I came in here with a very serious condition. I didn't think I would make it alive then. But due to the expertise and the doctors and the specialists, after some weeks, I got better, much, much better. When I came, I couldn't walk. It was a serious issue. But I thank God, you can see me standing on my 2 feet and looking better than when I came. Due to the care and the experience I got here, the treatment and the experience I got here is second to none. Today, I'm here for one or two things for a checkup. I'm doing better and I'm doing good.
And the 2 men sitting down here, this is Ibrahim Taiwo. He was operated here around April 2nd or so, then, this year, for hernia. And something has been with him for over 20 years, while on the street. But when they got to us, then he complained that he had severe pains. And we brought him here there to discover that he had ailment, which is hernia, and he's been operated upon. But the day he was operated upon, the mother got converted that very day. That she never knew things like this exist in Redeem. And she was so thankful to Mama Dio on that very day. And since that time, he has been living healthy, doing things right up to now. Then the other man, the other boy here, his name, we used to call him the Apostle, Amos Emmanuel, from Jakonde in Nigeria, where they brought him also. And they brought him 2 years ago. But the father decided not to even see him at all. So he has been on the street right from his infant like that. So we went for evangelism and they brought him. Now in school, but the same ailment, the man he had the same thing he had then. So he was operated May this year, and he spent almost 3 days in admission at RHV. The mother came, the father came, the stepmother also showed up, and they were all impressed and they are grateful.
I'm really, really impressed with what I've seen here. And of course, I want to tell everybody that, okay, you don't have to go abroad to get good health care. Here they have the human power, they have the resources, they have the equipment, and then on top of that, they're not like overly expensive. You know, they're not overly expensive. And you get value for your money, which is the cocoa. Like you're spending money, but you're getting, you know, value for your money. So I'm going to shout it as much as possible to my fans, to my family, to my friends, to come here and, you know, experience the world-class service.
We are presently in the redemption camp in a peculiar place where our staff they live within. We have facilities where if patients leave the north to come here to be cared for, we have over 30 to 40 hotels within the camp. We have pharmacists within our facility. We have eateries, we have everything. And within the hospital, we also have a cinema for our patients. So we are an all-encompassing facility.
More so, the other supportive services like our the canteen, our inpatients are well taken care in terms of their food. We have an in-house dietitians and nutritionists, and if somebody is on a special diet, they are ready to attend to it.
Not all journeys end in healing, but every life deserves dignity. At Redeemer's Health Village, even in death, compassion remains constant. The morgue is not a place of fear, but of final honor, because how we say goodbye is part of how we love.
Sad enough, not everybody that enters the hospital will go out because there's some sicknesses that are unto death. In that light, we have a mortuary on site to be able to provide care for patients who are no longer with us, and to give family the opportunity to also see their patients and prepare them for last offices.
There's CKD pandemic in the world. 80% of patients out there are less than 50. So as youth and young adults, we need to watch ourselves, watch what we eat, take enough water, exercise regularly, and most importantly, do your kidney function test. Kidney function test is just a blood test. They're just going to take 2 ml of your blood, and it's at a very affordable price. I mean, very affordable. Come to the hospital, we take your blood. In less than 2-3 hours, your result is out. And trust me, the people that will consult you to tell you how your result is, they are very friendly. So please, come to the hospital, check your kidney function test, and I pray God will help us.
RHV is being primed as the training institution for the Redeemers University, because they are starting basic healthcare, like basic medical sciences. So we are going to be training doctors that will come out as, that will have MBBS degrees. So we are looking at all those collaborations with all these institutions out there. So a lot has gone on there. And then because a lot of tours, at least they come here, since we are quite new on the block, they've been coming for facility tours. And
the future of healthcare is not far away. It's already happening at Redeemer's Health Village, a beacon for returning medical professionals, a hub for medical tourism with world-class equipment, a helipad for urgent transfers, and an ever-growing team. RHV has set a bold goal to change lives and redraw the medical map of Nigeria with excellence.
We also have an helipad on top of this building. So for private air ambulance with the helicopter, the patient can be moved to this facility and we can admit. So from all over these environments, we can take people by air. So we have an helipad.
All of this is targeted at ensuring that the patient is treated like a king, not just in terms of the hospitality, but in terms of the quality of care that we are giving to the patient. Yes, people should visit RHV because you are not going to get better care anywhere else in this country. You are going to get evidence-based care, you are going to get good hospitality, and at the end of the day, you are going to live a lot better than you came in.
At every hour, in every season, Redeemer's Health Village stands true to its promise. A sanctuary of care, a village of healing, a vision fully alive, day or night, rain or shine. One truth endures for every soul who enters. You are never alone. Redeemer's Health Village, healing with heart.